Alrighty. Well, in the interest of time, we'll keep things moving. So we will have some time for question and answers at the end of the session. Please direct all questions via the Q&A button on the Zoom panel. That will allow you to ask your question and allow us to track them. Please know that this session is being recorded and will be sent out after the webinar. So if you registered for this, you will get access to this recording and be able to review it at your own time. Today, I'm excited to be joined by two wonderful people, Tricia San Diego from AARP and Rebecca Kinney from ACL, who will come on later in the presentation and talk a little bit more about ACL and the resources that the SHIPs and other organizations have to help support Medicare. But in the meantime, it's my pleasure to hand it off to Tricia San Diego from AARP to provide the main part of our presentation today. Tricia, over to you.
Hi, everyone. Thank you so much for joining today. We are so happy to have you here. This is all about Medicare 101 for basically you, your business, and your eligible employees. And we want to talk about today the basics of Medicare, just to give you some foundational knowledge about the different parts of Medicare, what's covered, the costs. We're also going to talk about how you can help educate your employees as they become eligible for Medicare, or when they retire, what kind of health coverage decisions they need to make. It's really important to be able to meet employees where they are, and if they are at work and trying to make these healthcare decisions, although it might not be something that you're required to do, it's helpful to them so that they can make sure that they make the best informed decisions for themselves. So I kind of talked over what the agenda is. We're going to talk about basics, we're going to talk about education, and then we will also equip you all with a number of resources and tools. So first off, the common questions that I'm sure you get possibly when people are asking you questions about health coverage and Medicare. What is Medicare? What is actually covered by Medicare? Who's eligible? You probably get questions about enrollment. How do I enroll in Medicare for the first time? Do I have to enroll in Medicare for the first time? What happens if I don't do that? And that's an important question because there are impacts to not enrolling at the correct time. How will Medicare work with my existing healthcare? Think about what you offer in terms of employer coverage and retiree coverage, and it's helpful for you to know who to direct people to if they have questions about how Medicare and your existing coverage work. But we'll kind of cover the basics, and it'll be general information, but make sure that you talk to your providers, your brokers, your HR department and benefits professionals to get a better sense of your own plans that you offer. So your role as a business owner. The one thing I wanted to drive home is that you don't have to be a Medicare subject matter expert. There are plenty out there, and it takes a long time to get to be a Medicare subject matter expert because Medicare can be very overwhelming. There are a lot of different moving parts sometimes. There's a lot of changes. So it's kind of hard to stay up to date and to know every little thing about Medicare. So we just want to equip you with some foundational knowledge so you have the ability to answer some of those really common general questions, but really we want you to be able to know who to connect your employees to when they do have questions. And I want them to be connected to people who will provide unbiased, trustworthy, reliable information about Medicare. So your role is to provide Medicare eligible employees with educational materials, to connect them with those trustworthy sources of information, and to help these employees avoid enrollment penalties, I think is one of the biggest impacts. As I mentioned, if employees are enrolling for the first time in Medicare, there's a lot of decisions that they have to make in terms of how they're going to get their Medicare coverage and when and what kind of coverage they're looking for. And so you do want to help them avoid enrollment penalties, but also avoid gaps in their coverage. Next slide. So let's begin with the basics. What is Medicare? Medicare is a federal health insurance program for people age 65 and up. It's also for those who are under age 65 who have certain disabilities or people of any age with end-stage renal disease. It's also people with ALS, Lou Gehrig's disease, it's also applicable for them. Next slide. Employees are responsible when it comes to Medicare. These terms, these are the things that will come out of pocket. These are out of pocket costs. And these are the basic health insurance terms that you may know from your existing plans and offerings. But just so that you have a little bit of a primer, it is things like your monthly premium. There you might pay a portion of monthly premiums for your employees, or if not, it's the employee responsibility to pay a certain amount every month in order to get the insurance. And so the same thing holds with Medicare. There is a monthly premium amount that an individual pays to pay Medicare or private insurance plan for their health care and their prescription drug coverage. The deductible is the amount that an individual would owe for healthcare services that the health plan covers before your health plan begins to pay. So it's kind of this threshold amount that you need to reach before insurance and Medicare will kick in. The deductible may not apply to all services. For example, things like preventive care sometimes does not apply towards the deductible. So you just really have to look at the plan. Coinsurance is the amount that an individual may be required to pay as a share of the cost for services after they pay any deductibles. Coinsurance is usually expressed as a percentage. For Medicare, most of the time, the coinsurance that the patient or the employee is responsible for paying for services is usually around 20%. Medicare covers 80%. Copayment is the fixed amount an individual would pay for a covered healthcare service, usually at the point of where they receive the service. So when you're at the doctor's office or when you do a test, there's sometimes a copay that you usually pay while you're there, or you'll get billed for it later. And it's like a flat amount, maybe $20 to see a primary care physician or $30 to see a specialist. So you have to look at the plan definitions and see what the copays are. But all of this, it makes up what's going to be the out-of-pocket costs for the employee. What does Medicare not cover? This is a question that we get a lot at AARP, and sometimes it's surprising for some people. Medicare does not cover things like vision, dental care, in most cases, hearing, or long-term care, such as extended stay in a nursing home. Medicare Advantage plans, which I'll talk a little bit about in a little bit, sometimes can cover these, but traditional Medicare, also known as original Medicare, does not. And we'll talk about the difference between original Medicare and Medicare Advantage in a moment. The fact that Medicare does not cover long-term care services is what I think is most surprising to a lot of people. A lot of people assume that Medicare covers for things like nursing home stays. And Medicare actually only helps cover certain services if they are medically necessary. It doesn't cover custodial care. Custodial care is going to be care that you need for activities of daily living, such as bathing, eating, dressing, using the toilet. Those kinds of services are not covered by Medicare. And like I said, that those are all under the long-term care umbrella. And that is a surprise for many people. Next slide. We're going to dive into the alphabet soup of Medicare. Medicare does have different parts, and those parts are associated with letters, and I'll go through what that is, but it can quickly get confusing because there's sometimes a long list of letters. So we're going to start with Part A, and Part A is hospital insurance. It's going to cover things like inpatient hospital stays, hospital care, some hospice and home health care, and some skilled nursing facility care. But as I mentioned prior, it doesn't cover in general long-term care for things that you need for help with activities of daily living. Part A is hospital insurance. We're going to go on to Part B, which is related to, Part A costs, which the costs associated with Part A typically, there's no premium for Part A. Most people who qualify for Medicare don't pay a premium for Part A because they've already paid for it through payroll taxes while working. If for some reason, you didn't work enough sort of eligible, I think, hours or quarters that are needed to qualify for premium-free Part A, you may be able to buy Part A under certain conditions. But Part A does have coinsurance in addition to a deductible. There is a deductible of $1,556 for days 1 through 60 of inpatient care in 2022. And sometimes costs will fluctuate from year to year. And that's for inpatient costs for each benefit period. The benefit period ends when you haven't gotten any inpatient hospital care for 60 days in a row. If you go into a hospital or a skilled nursing facility after one benefit period has ended, a new benefit period begins. So as you can see, we're only at Part A, and it kind of already gets confusing right away. But in general, there are costs associated with Part A, typically no premium, but there is a deductible. Next slide. Now we're going to go to Part B. Part B is going to cover medical insurance. So medical insurance is going to cover your doctor visits, outpatient hospital services, durable medical equipment, Medicare approved preventive services, the things like laboratory tests, x-rays, some mental health services. Those are going to tend to be covered all under Part B. Now let's look at the costs associated with Part B. As I mentioned, there are things like premiums and deductibles. Well, for Part B, there is a standard monthly premium for original Medicare, and that standard premium costs $170.10 per month for those who are enrolled in Medicare in 2022. Premiums do go up for those with higher incomes. Those are called sort of income-related adjustments, and you end up paying a little bit more depending on your income level. Those with higher incomes, individuals earning more than $91,000 a year, for example, or couples earning more than $182,000 a year, they will pay premiums based on their income. Looking at the deductible, the annual deductible is $233 per year, and coinsurance in general is about 20% for most services, and this is all for 2022. Next slide. Part C, it's kind of misleading that it's called Part C because it's not really a part to Medicare. It's actually an alternative option altogether for getting your Medicare. Part C is also known as Medicare Advantage. So normally with original Medicare, which Part A and B make up, you can purchase Part A, purchase a Part D prescription drug plan and have Part A and B, and that's original Medicare. Or you can go and have Part C, and that's a Medicare Advantage plan. This is an alternative to original Medicare. The plans offered are normally from private insurance companies who are regulated by CMS, the Centers for Medicare and Medicare Services. All the plans are going to include hospital insurance, Parts A, as well as medical, Part B. And in most cases with Medicare Advantage, Part D, which we haven't gotten to yet, but Part D stands for prescription drug coverage, is usually included in Medicare Advantage plans. So there are advantages of kind of being a one-stop shop when you go with a Medicare Advantage plan as your option for getting Medicare coverage. But then there are some drawbacks potentially in terms of limitations on who you are able to see, who's in the network. When you're traveling, are you eligible to use your Medicare Advantage plans? There are some limitations. So you really need to, employees need to really look at their sort of lifestyle and what their preferences are and really kind of study the differences between the options for getting your Medicare. Another important thing to note is that if you do purchase a Medicare Advantage plan and go that option, that may limit the ability to purchase a Medigap plan in the future. We haven't gotten there yet, but Medigap is a supplemental insurance plan that someone can get when they have original Medicare. So lots to learn about the options, and we'll dig a little bit deeper. Medicare Advantage, how they work. I talked about some limitations in that you have to live in the plan's service area. Plans are available in most parts of the US, but you have to live in the plan's area to receive services. And you must choose from plans that are available in your area, and you sign up directly with that plan provider. Medicare Advantage plans pay for the same healthcare services as original Medicare, but they also might pay for additional healthcare services. Like I mentioned, Part D drug coverage may be included there, but then the things that aren't normally covered by original Medicare, vision, hearing, dental, sometimes you can find a Medicare Advantage plan that includes all of that under one plan. In most Medicare Advantage plans, you can only go to the doctors, the specialists, the hospitals that are on the plan's provider list in order to kind of stay in network and to have it covered at the highest amount. Plans may limit coverage or provide no coverage for out of network providers. So you have to follow the insurance company's rules, and they may even require things like a referral before you see a specialist or before you go out of network. So there are some limitations, but then there's also some benefits. You kind of just have to decide what works best for you, but make sure you fully understand how Medicare Advantage plans work before you, or if you're advising someone else about Medicare Advantage, before they join. Moving on to Part D. Part D stands for drug coverage. That's prescription drug coverage. Part D is going to help cover some of the costs of prescription drugs that an individual would pick up or get through mail order at a pharmacy. Part D plans are run by Medicare-approved private insurance companies. To get Medicare prescription drug coverage, you must join a plan run by an insurance company approved by Medicare. If an individual is eligible to join but do not, there could be a late enrollment penalty. Oftentimes, employers have a role where you need to state that the drug coverage that you offer, perhaps you offer prescription drug coverage through your own benefit, you have to prove and send a letter to your employees stating that it's creditable coverage. And that's why we mean that an employee needs to know that their current drug coverage, if they decline Medicare Part D and they stick with the employer-based one, we have to make sure that that plan is as good as a Part D plan that they could get at Medicare. So that's another kind of role that employers have to play in prescription drug coverage. The costs, like Part A and B, there are premiums, co-payments, and co-insurance. There's an annual deductible of up to $480 per year in 2022. And like Part B, people with higher incomes may pay higher Part D premiums. So that's something to take a look at to see if you have this sort of income related adjustment that just to help manage expectations when someone's eligible for Medicare, how much the costs are. Going now to that discussion about the options for Medicare. I talked about the choices. When someone's first enrolling in Medicare, and even after every year after that, you have this decision, this choice to make whether you want to stick with original Medicare, which is kind of a la carte. It's Part A and B, and then you can optionally purchase a Part D prescription drug coverage plan, which we do recommend you purchase if you need drug coverage. And then sometimes you can purchase a Medicare supplemental plan to help pay for some of the costs of Medicare that the other parts don't cover. So that's sort of this a la carte way of getting your Medicare. The other option that I talked about is Medicare Part C, which is also known as Medicare Advantage, and that's more of your one-stop shop where parts A, B, D, and maybe even some other sort of extras like dental, vision, hearing are sometimes already also included under one package. I think one great anecdote that analogy that I've always heard to compare Medicare, original Medicare with Medicare Advantage is think about, let's say, going to a restaurant. Do you want to order something a la carte, your appetizer, your entree, your dessert, and you have more choices, perhaps a larger kind of options, or do you want to go with the fixed price menu? And that's more the Medicare Advantage option where everything's kind of set in terms, there's a few choices that you have to make with appetizers and desserts and entrees, but you kind of have to just stick to what's on that fixed price menu. You can't go sort of out of network off the menu, that kind of thing. I think that's the best analogy. So this is probably the biggest decision to make when first enrolling in Medicare is which way you want to go. Next slide. Talking about original Medicare, it is a fee-for-service plan. It's going to include parts A and B, like I mentioned. You can have that flexibility by basically being able to go to any provider that accepts Medicare. And you also have to be careful. There are some providers who, yeah, they may accept Medicare, but perhaps you're not accepting new patients. So if it's a new provider to you, you can't go there. So you do have more of that flexibility in order to see who you want to see. You can also choose and join a Medicare prescription drug plan for that drug coverage. If you think you need it, that's something that you would buy along with having the A and B. Next slide. So talking about enrollment periods and when to enroll, we always hear about age 65 being that magic number, but there's a lot of dependencies on when employees should enroll in Medicare. And so we're going to talk about a few different enrollment periods. The initial enrollment period is a 7-month window that is centered around that person's 65th birthday. The initial enrollment period is the 3 months before the month that they turn 65, the month of their 65th birthday, and the 3 months after they turn 65. You have the 7-month window to enroll in Medicare for the first time if they have to, and that's that initial enrollment period. And then there's also a special enrollment period if you miss it, or if someone declines Medicare and decides to join later. Let's say if you have employer coverage and you're going to stick with that and continue working, that's an option. Then we're also talking about an open enrollment period, which is where those who are already enrolled in Medicare can make changes. So the initial enrollment period, diving a little bit deeper into that, if employees are receiving Social Security already, let's say you started collecting at age 62, you are automatically going to be enrolled at age 65. I would always call the Social Security Administration and confirm and double check and be proactive. But in general, if you are already receiving Social Security, you are automatically enrolled in Medicare at age 65. But make sure you have things in writing and make sure you follow up and confirm. Employees have that 7-month window that I talked about to enroll around your 65th birthday. If you don't enroll during that initial enrollment period and you had to enroll, and there are certain situations where you almost have to enroll at age 65 or during your initial enrollment period in order to get coverage. If you don't do it during then, you can incur late enrollment penalties. And those penalties will apply for Part B and Part D premiums. And I think there's even a Part A late enrollment plan penalty as well. But in general, if you miss the window and you're supposed to enroll and you don't, you do end up paying higher costs. Not only that, you may also get coverage gaps. So that's another thing that we want to prevent employees from doing. The special enrollment period. So for employees who do not enroll in Medicare when you're first eligible, but you have a valid reason to, for example, if you are over age 65, but you're currently working and are covered by employer health coverage. So if you're in a larger business of 20 more employees and you're still offering your health care, the employee has the option to continue with the employer-based coverage and decline Medicare, and then join Medicare later. And that's valid because you already have this employer-based insurance. So if they do that, there's a special 8-month window called the special enrollment period. And that will be triggered when the employees lose employer coverage, either at the end of employment or at the end of their employer coverage. So that 8-month window is another time where someone can enroll and not incur penalties, but that's only valid if they have existing coverage. For example, their work-based coverage, they want to continue using that, or their spouse's coverage. And then let's say they retire or lose employment, then at that point is when you're triggered to be eligible for this special enrollment period. Employees who miss the initial enrollment period for no exempt valid reason like this, you can enroll during another period called general enrollment, and that happens at the start of each calendar year. People who don't enroll in Medicare and don't have an exempt reason, you don't use that special enrollment period. You're going to use a general enrollment period, and you are going to be likely to pay a penalty. Next slide. The last enrollment period we'll talk about is open enrollment. That is sort of the annual time every year that people who are already enrolled in Medicare have the opportunity to make any changes in their coverage. If you want to switch between those two options of Medicare, if you want to go from original Medicare to a Medicare Advantage plan, or vice versa, you can do that during open enrollment. If you want to switch your Part D plan because you're not a fan of the Part D plan, this is the time to do it during open enrollment. So when you enroll in Medicare for the first time, you're not locked in to this lifetime decision. You do have to decide initially for that first year you have Medicare, which way you want to go, how you want to get your coverage. But if for whatever reason you're not happy with your coverage, just know you always have this annual period during October 15th through December 7th to make any changes to your plan. And that's open enrollment. That's not the period. That's for people enrolling for the first time. People enrolling for the first time have an initial enrollment period or special enrollment period. So let's go over these penalties. I was right. There is a Part A penalty if you don't enroll at the correct time. It's up to 10% increase for monthly premiums for twice the number of years not signed up. Part B, there's a 10% increase for monthly premiums for each 12-month period not signed up. And then look at the second sentence. The penalty will stick for as long as you have Part B coverage. So that could be something that's lifetime. That penalty, that extra 10%, 20%, however late you enrolled in Part B when you should and you didn't sign up when you could have, these are penalties that can stick with you for a really long time. Part D, I'll let you read that slide. It gets a little bit confusing, but it's 1% of the national average monthly premium times the number of months that you didn't have Part D or creditable coverage and you should have. So that's another thing that adds up. These are penalties that we want you and your employees to avoid by providing the right kind of education and reminders about initial enrollment and when someone has to enroll versus to avoid penalties versus when they're able to delay. So this is why we offer these types of sessions, because it's really important the role that you can play to help prevent this kind of financial impacts on your employees. And so just one thing that I really wanted to emphasize is just take a look at that Part B. It's going to be something that's that adds up, and it can stick with you for as long as you have Medicare. Next slide. So Medicare and your business. Now that you're familiar with Medicare as a program, the rest of the session is sort of what it means for you, what your role is, and how can AARP and SHIP and all of us working to educate people about Medicare enrollment, how can we help? We have lots of resources to share. I mentioned earlier a note about employer size and how that determines Medicare requirements. So how Medicare interacts with existing employer coverage is determined by the employer size. For large employers, the work-based coverage does usually stay the primary payer. And then if an employee decides to enroll in Medicare, Medicare will become secondary coverage. And it's actually the opposite for the small business. For small employers, which is the first left side, I started with large employers, but if you look at the slide, the left side of the slide refers to the small employers. It's the opposite. For the small employers, if you work for one, eligible employees must enroll in Medicare, and that's if you have fewer than 20 employees. Medicare becomes primary and any work-based coverage becomes secondary. And note that that work-based coverage won't pay anything unless Medicare pays first. And so Medicare has to be primary. So if you work for the small employer, you have to make sure that the employee is enrolling in Medicare at the right time, because that becomes primary coverage. For large employers, it's reverse. The work-based coverage stays primary, and then the employee, if they opt to enroll in Medicare, the Medicare becomes a secondary insurance. Next slide. So here's some examples, some common scenarios. For small employers, it's pretty straightforward. Medicare is the primary payer. And so for small employers, if there's a failure to enroll, that employee could end up with uncovered medical expenses, gaps in coverage. The vast majority of employees enroll in Parts A and B during initial enrollment if you work for a small employer of 20 or less. For large employers, there's a few different scenarios. Obviously, there's a lot of variation, but typically this is what you're going to expect from employees. They could, for example, enroll in Parts A and B during their initial enrollment period, that 7-month window around their 65th birthday. They could do that. They could enroll in Part A during initial enrollment, but delay Part B, assuming this employee is still covered by an employer plan, until enrollment during a special enrollment period. So this is one of those exempt reasons where the reason why the employee would move forward with enrolling in Part A is because Part A is sort of already prepaid, and for many it's premium free. So there's no cost to enrolling in Part A if they had enough work quarters that made them eligible for it. So that's why a lot of people will go ahead and enroll in Part A, but then they'll delay Part B enrollment. The third scenario is you delay Parts A and B enrollment altogether and you wait until that special enrollment period, that 8-month window kicks in. And when they, let's say, retire or they lose their job and they lose their coverage through the employer, that's when they have this special enrollment period that's 8 months. They're able to enroll in Part A and B during that time. Medicare Part C and D may also be included during the scenarios listed above, but it sort of depends on it. And Part D will have sort of a shortened special enrollment period. So that's another thing to note. Next slide. What can you do and what does a timeline look like for you? As you can imagine, Medicare gets overwhelming and it's a lot to take on. And I'm sure there's a lot of other things that they're thinking about. And what you can do is point them to the right resources and help remind them when to start reading these resources and educating themselves so that they can make the best informed decision. We're not expecting all employers to know everything there is about Medicare and to provide advice necessarily. It's such an individualized decision. You don't want to lead any of your employees the wrong way or provide the wrong advice, and it may have lasting financial impacts on them in terms of penalties or coverage. So just to kind of avoid that, you want to really serve as more of a support and helping remind them and pointing them to where they need to go. One thing that could be an example that's useful is 6 months out before the 65th birthday of your employee, send an introductory letter that just kind of says, hey, this is coming up on their horizon. Here are some basic information about Medicare. And then as you get closer, once their initial enrollment period opens, that 3-month mark before the month of their 65th birthday, that's a good time to dig in a little bit deeper about initial enrollment period and whether or not they have to enroll because of their employer size. You know, is it something where Medicare has to be primary and you're a small business? They have to sign up. You're going to really want to remind them to do that during that initial enrollment period. And it's very helpful to do for them to enroll in those first 3 months versus wait till the end of their 7-month period, just to help avoid any kind of coverage gaps and to have coverage as soon as the first of the month of their birthday. I think it's the best time to do it during the first 3 months of their initial enrollment period. So you could do a communication around then. Then, you know, when you send a happy birthday card or communication, maybe send another reminder. You know, it was your 65th birthday and here's some other resources that could be helpful. Could you send a third-party resource list, some ARP resources, remind them to go to the SHIPs, which we will talk about very shortly. And then still staying within that initial enrollment period, maybe do another final communication of, you know, one last reminder, your initial enrollment period for Medicare is going to end. With all of this communication and education and reminders, I don't think there's really any excuse for someone to enroll late. in Medicare if they should have enrolled during their initial enrollment period. It's different if they have this sort of exempt reason to delay their Medicare enrollment. Let's say if they are eligible for the special enrollment period, or they're going to continue to work and they work for a larger business. But if you can provide some support and help and give these communications to them, these educational resources, I think that's a really good role that you can play that's very supportive of helping them make an informed decision. Next slide. So just to summarize, engaging your employees on Medicare hopefully shouldn't be too hard. We're not asking you to be experts, like we said. You don't have to know everything about Medicare, but can you be that helpful nudge, that helpful reminder, that source of information, though, when it comes to questions about your own plan that you offer and how that works with Medicare and whether or not they're required? I think that's where they're really going to need you. But clear and consistent communication is going to be critical. And those reminders. Only refer employees to trusted sources of information, reputable sources, unbiased resources, third party. We'll talk about nonprofits who are in the mix. And then, of course, Medicare.gov is a really great resource for trusted Medicare information. You want to talk and educate to employees about Medicare prior to eligibility. We talked about sort of that 6 months intro communication that just says, hey, this is on the horizon, something for you and or your spouse to start thinking about, because we know that it's a family decision, and it's just a lot of different things at play that are very individualized to that person, depending on their work situation and their other coverage that they may have. So that's just in general, I think the ask for employers is to be a helping hand and communicate often and early about Medicare, provide education. We have some great resources to kind of help out that with you. And perfect timing, we're going to head into what some of those resources are. I mentioned Medicare.gov. Medicare is a federal run insurance program, and it's through the Centers for Medicare and Medicaid Services. We have this website. They have this website, Medicare.gov, as well as the phone number for any questions. So Medicare.gov is going to be a prime resource for Medicare questions. If they have questions about their choices of plans, they can talk to SHIP counselors, but you can also get some really great information here on Medicare.gov. And remember, you can get the most out of your Medicare coverage by reviewing the benefits yearly and, staying up to date on what Medicare does and doesn't cover. And if people are unhappy, they can make changes. Next slide. Medicare Rights Center is another nonprofit that AARP collaborates with, and they do provide helpful information about Medicare. But we also have the State Health Insurance Assistance Program. We call them the SHIPs, and we refer many people to SHIPs because they will provide excellent one-on-one, unbiased, trusted counseling about Medicare. I just talked about how Medicare is so individualized. It's hard for us to be able to answer everyone's very personal individual questions, but you can really kind of get down into some of those details and talk through it with a counselor at SHIP. And I'm happy to pass it over to Rebecca Kinney from ACL, who will talk a lot more about SHIP services that you can use for yourself, your family, and refer your employees to.
Okay, great. Thank you, Tricia. Hello, everyone. Thank you for joining us today, and thank you to AARP for including us in this presentation. I am Rebecca Kinney. I am the director of ACL's Office of Healthcare Information and Counseling, and ACL is the Administration for Community Living. We are a small operating division under the Department of Health and Human Services, and ACL's mission is really to maximize the independence, well-being, and health of older adults, people with disabilities across the lifespan, and their families and caregivers. Really, our vision is to try to ensure that everyone can stay in the community and make their own choices and participate fully in society and on their own terms. And we support programs and services to help them do that. And one of the programs that I oversee with ACL is the State Health Insurance Assistance Program, or the SHIP. Our SHIP is a national program. There is a SHIP in every state, DC, Puerto Rico, Guam, and the US Virgin Islands. And the SHIPs are really a national network of local community-based organizations that house counselors, team members that are fully trained and certified. And we do background checks and all sorts of screenings to ensure that we have trusted folks on the ground available to provide that one-on-one assistance to Medicare beneficiaries, their families, and caregivers to help them make informed decisions on their Medicare choices. As Tricia has gone through today, Medicare is really confusing, especially when you first become eligible. And the SHIPs provide a lot of assistance to folks who are first becoming eligible to Medicare, but even after they have Medicare, helping them navigate their options and make sure they can access their benefits. Annually, we typically provide 2.5 million one-on-one counseling sessions in the year. 40% of those are during open enrollment, which is that period in October through December when everybody needs to make a choice on their Medicare. We also do a lot of outreach and education events in the community and serve approximately 4 million individuals through those community events annually. And those are good times where we go out and interact with groups and provide general information on Medicare, similar to the presentation you saw today. The SHIPs are able to provide. Also happy to partner with other community organizations to provide education either to their beneficiaries or their employees, depending what the situation is and what makes sense. And really the SHIPs help, as I said, anyone on Medicare or their family members really navigate the enrollment decisions on Medicare, but also how to access other benefits, such as benefits for those with limited income and assets, Medigap insurance, anything like that. The SHIPs will help folks navigate. And next slide. If you are interested in connecting with your local SHIP, and I encourage you to do so that you can send your employees to the local source, you can find the link to the websites of our local SHIPs and also phone numbers at our national website, which is at shiphelp.org. There's also a national phone number, which will geo-route to the local SHIP when you call that. But you can send folks to the locator and they can locate the SHIP in their area and hopefully be able to get connected one-on-one to someone, help them navigate their decisions as they're looking to enroll. And I believe I will turn it back over. Thank you.
Thank you so much, Rebecca. I can't say better things about SHIP. I think it's been really helpful for people to be able to have access to that one-on-one unbiased counseling and to be able to just talk to someone. So a lot of times you need to talk through this on the phone. It's hard sometimes to cull through all the information that's out there. Sometimes you don't know if it's a trustworthy resource, but SHIPs are. And they are so great. So thank you for all the work that you guys do and all the help that you provide. And the best thing, this is a free service. So again, employers, you don't need to take on what it takes to be a subject matter expert. Feel free to direct those tougher questions about Medicare to your SHIP counselor. Just go on that website and find the local SHIP. ARP has some great resources about Medicare. We have a Medicare Resource Center online. It's available at aarp.org/Medicare, another great resource URL when you're sending lists of resources to your employees of where they can turn to for information. We have this website. Next slide. We also have a great tool that we actually just launched last year. It's called the ARP Medicare Enrollment Guide. And this is all pure education. And this is a tool where you're able to kind of select what kind of situation you're in, and then it'll take you through different paths so that you can learn more about what you need to do. For example, if you are continuing, you currently have work-based coverage and you are planning to continue to work past age 65. What are the things that I need to consider? What's general information about someone in my boat? If you are retired already and you currently have Affordable Care Act coverage. I mean, we have all different sort of scenarios, kind of choose your adventure and it'll help direct you to what you need to do. So another really great tool that's available for free. And this is all part of our social mission education side of things at AARP. Another great tool you can refer your employees to, or you can go to yourself if you're self-employed or trying to make your own healthcare decision around Medicare. This is another great place to start, aarp.org/learn-Medicare. And then we also have ongoing consumer webinars. They're available at aarp.org/Medicare Employer. These are webinars that happen throughout the year. They're recorded and available on demand, and we dive a little bit deeper into certain topics. So for example, during open enrollment period in October, we'll dive into what you can do during open enrollment. Sometimes we'll do a specific session about Medicare and working. And so we have a number of these webinars, and you can attend live or encourage your employees to attend these live, but if they're not available, you can always watch them on demand. And so this is another great resource to turn to if you want to kind of do a deeper dive on some of those topics. Next slide. Conclusion already. It went fast and there was a lot of information, but in general, what we covered today is the Medicare basics, which is sort of the extent of what we're hoping has increased your knowledge, is all those different parts about Medicare and what's covered, what's not. So those basic foundational stuff that get people really tripped up pretty easily, very fast because of all the moving parts of Medicare. We talked about how you can educate your employees on Medicare and the why. Why should you? Because it will help them avoid penalties, those penalties that can really have an impact on one's finances, but then it can also help prevent coverage gaps. You don't want anyone to really to be without health coverage and to have to pay for all healthcare costs, which do increase as you age, out of pocket. And so it's really important for you to be a partner in this and to help support your employees as they make their health coverage decisions, make sure that they're informed and that they're aware of those deadlines. And then we provided some great resources and tools and had our collaborators in the SHIP program join us today. And we're very grateful for that. And I want to open up to questions. If anybody has any questions, to please let us know. Colin, if there's anything you wanted to add or if anything came through.
Yeah, we are actually starting to get a few questions come in here. But before I did that, I did want to, we always like to get feedback from everybody when we are operating and having these webinars and conversations. So I'm going to launch a poll question that should jump on your screen. But we would really value you to take just a few seconds here to answer a few questions to let us know what you thought of the presentation and kind of your reactions here. And go ahead and do that now. We'll leave it up here for a few more seconds as people are starting to fill it out. And we will start answering some of your questions. Great. And, Tricia, one of the questions that I'm seeing kind of come through here is one, it says, I hear a lot about open enrollment on the news. Is this the time for employees to sign up for Medicare if they're new?
No, and that's an important distinction. Open enrollment, which is October 15th through December 7th, is for existing people who already have Medicare, so existing coverage. The people who are enrolling in Medicare for the first time, you're going to do that during your initial enrollment period, that 7-month window around your birthday, or if you have an exempt reason and you delayed your Medicare enrollment, you would do it during your special enrollment period, which is that 8-month period you have after you, for example, retire or leave your job-based coverage. And then there's the other option, which is the general enrollment period, which happens at the beginning of the year. That's if you, missed the boat and you didn't enroll when you had initial enrollment or special enrollment period, and general enrollment period is when you would most likely be enrolling, but then you will be incurring those penalties.
Gotcha. Really helpful. And I saw another question come in that says, what happens if one of my employees misses the deadline to sign up for Medicare? Are there any consequences or any risks associated with that?
The consequences and risks, it always helps to reiterate, is the penalties and the gaps in coverage. So you really want to encourage them and remind them. I think that sample communication timeline that we had could really help. And it doesn't have to be anything very lengthy or incredibly detailed. It's really a nudge to point people to where they can look for more information. But yes, you will have penalties. Part A, Part B, Part D does have penalties associated with it when you enroll, when you don't enroll, and you should have. And as you saw, some of those penalties can stay with you for a while. They're sort of forever penalties, and you don't want to incur those if they're completely avoidable. So yeah, there are repercussions.
Okay, great. And I think we said two more here before we can kind of close out. The first being, besides sharing resources, are there other ways for employers to educate themselves and their employees about Medicare?
I think sharing resources is great. Checking out going through the tools yourself is helpful, because then you kind of have a sense of clicking through and what kind of information is available to you. But I will again put in a plug for the SHIPs. If you want to learn more about Medicare and have specific questions, talk to a counselor and they can provide you some assistance. And if they don't know, I'm sure they can refer you to the right person to talk to. And it's just a really, really good resource for sure.
Great. And then I want to kind of invite Rebecca back on to talk a little bit more, because I just got a question about unbiased information, because we know there's a lot of information out there. Rebecca, if you could kind of build on what Tricia said, talk a little bit more about the SHIPs and more importantly, where people can find out more information.
Yeah, sure. I'm happy to. Thanks, Colin. So the SHIPs are, as I indicated, a federally funded resource. And it is a required per the law that the SHIPs must be unbiased in those services that they are provided. So the goal of our program is to provide information on the Medicare options so that folks can make an educated decision on what to choose. But we're really careful about ensuring that we're providing all the options that are available from all the different companies that are offering the insurance, and providing it in a way that is unbiased. And as Tricia indicated, it's also free as a federally funded resource. And, our target is to serve Medicare beneficiaries and their families. However, we're also happy to help employers who are trying to navigate this, get some basic information, provide presentations to your employees if that makes sense. Happy to come in and do that. And as we've been indicating, be there as a resource for your employees so that when they get to the point where they need to make a decision, particularly if they're in a situation where they're trying to figure out with a spouse, what's going on with their spouse's coverage and their coverage when one of them becomes Medicare eligible, what does that mean? Those kinds of complicated scenarios, the SHIPs are able to assist with, and happy to help. And you can, again, find them if you go to the shiphelp.org website and use our locator to find the SHIP in your area.
Well, I think that's all the questions that we had kind of come in here, and be mindful of time. Tricia, Rebecca, any kind of final closing comments or thoughts for the folks on the line?
I just wanted to say thank you. Thank you all for taking the time to learn about Medicare or have a refresher about Medicare. I mean, even myself, who works on Medicare almost every day, I get confused and forget, and it's a lot to take on. And so thank you for taking sort of a first step and partnering with us to help partner with your staff, your employees, to help them make the best health coverage decisions. But we're here to help. This is just one event that we can do. Like Rebecca said, happy to partner with you on future educational sessions if interested, and use the resources that are available to you. But yeah, Rebecca?
Yeah, same. Just thank you. Thank you, AARP, for including us, and thank you for all of you for attending. And we are here as a resource. Please use us to help navigate everything. And thank you for taking the time today.
Amazing. Well, thank you, Tricia, and thank you, Rebecca, for your comments today. We're really excited for the presentation. So with that, this is the end of the webinar. I hope everyone has a wonderful rest of their day. Thank you again.